We always put the onus on the patient. In my world of adult congenital heart disease, the patient was the child who grew up with multiple open heart procedures, was the child who was running around the playground with his or her friends, but his or her friends had no idea what this child has been through. And what happens is that these children live their lives, they don't know what normality is. They don't know what their world of normal is because they've had so many open heart procedures. And often I take the blame and put the onus on us as practitioners that, well, we should have readied these patients to come into the world of adult cardiology a lot better maybe. Sometimes we as physicians don't do due justice when we sit with these patients when they're 15, 16, 17, because we need to tell them that, yes, you had open heart surgery, yes, you had multiple procedures, but when you get to 25 and 30 and you get pregnant, your risk is going to be a lot higher than your friend who's sitting next to you because she didn't have 3 open heart procedures. And sometimes you can see the light bulbs going on in my clinic, not just with the patient, but mom and dad sometimes still come. And their light bulbs are going off. They're like, oh, nobody said this. Nobody told us when she was 12 that the risk would be higher when she's pregnant. I did my residency out at Penn State, and my track was a little bit different. It's kind of funny because I was a dual internal medicine and pediatric resident. So I saw both pediatrics and internal medicine. And when I was a resident, I started seeing patients in what we had a very small adult congenital center back home 15 years ago at Penn State. And I went and saw some patients. I said, this makes sense to me. These are kids who grew up and they're now adults and they have congenital heart disease. And my background was such that it just got my interest. And then when I went out to Ohio State to do my fellowship, I was lucky enough they let me do both fellowships in adult cardiology and in pediatric cardiology. So I was trained in both fellowships. So I was boarded in both. So I did adult cardiology. I took care of people with MIs and chest pain and heart failure and arrhythmias. And then I would switch over every 3 to 6 months. And I would go take care of the infant blue baby in the ICU. And they had open heart surgery. And I did that for several years. And so I just got lucky with my training where I came out with the best of pediatrics and the best of adult cardiology and internal medicine. If you believe this, I think there are only 18 of us in the country who are dual boarded. Yeah, it takes 10 years, so I wouldn't recommend it. but Right, so I see patients who are now younger patients in their 12, 13, 15 years old here at the Children's Hospital at CHAM, and we try to transition them in the sense that when you have someone like me who's trained in both adult and peds, it's a very easy transition because you're not changing hands, you're kind of staying in that world of adult congenital heart disease again, which is why I love my training, which is why I love what I do, because I can very quickly go from peds to adult and not have to change my mindset. It's wonderful. I mean, I really enjoy it. Sometimes I teach fellows who are pediatric fellows who come into my world of adult congenital heart disease, and I can see that they're not grasping the nuances of adult cardiology. And then I'll see the adult fellows who come to my clinic, and they're not grasping the nuances of complex congenital heart disease where everything's flip-flopped and so on and so forth. And I sometimes sit and thinking that thank God I did what I did, because I can go back and forth very nicely. So it works great. A lot. It doesn't stop. I mean, it's ongoing. It's hopefully we'll grow this program where, as the congenital heart disease program grows, we'll have more people doing adult congenital heart disease. We need it. But at the moment, yeah, it's my phone's always on. So, but it's fun. It's fun, and when you do something right, and a patient goes home and does well, or a young woman with congenital heart disease delivers and takes a baby home, you kind of go home sometimes and you're like, that was okay. That worked out well.